Papa Joe, wetin I be here say na it happen to Emeka? Emeka dey alright at all?
My brother, na so I take see am o. Na here where I dey, wey Mama Emeka call me for phone. He tell me say he wan carry Emeka as him dey come back for school. Na him Emeka fall for ground. Na him motor wan come jam Emeka, kill my Emeka for me.
Abba, Papa Joe, make we find doctor wey sabi wetin he dey do. Make him find out wetin dey happen to our children. We no go dey fold hands dey watch our children dey suffer for sickness like this. Children pikin wey dey born come dey suffer seizure, come dey shake body like say he wan die. We go find something wey we go do o, and make we do am on time o.
This matter don vex me. I don tire. This pikin dem, wetin we go do for them? E don happen so many times. No be once, no be twice. E don happen so many times. We go see that doctor, make we know wetin we go do for this pikin dem. 1, 2, 3, 4 times. Na wetin be this? E wan kill our pikin finish? Abeg, we must do something for this pikin dem. Make dem live for us, healthy and strong.
Aha, Papa Joe. Now wey you talk something wey sweet me well. First thing tomorrow morning, we go see Dr. Melvin. Abeg, shake me. You be correct father.
Today, we have with us Dr. Melvin. Good morning, Dr. Melvin.
Good morning, my dear. Good morning, lovely people.
Okay, that's beautiful. Today, Dr. Melvin would take us on a question and answer session on the topic management of seizure in kids. Dr. Melvin, what is seizure management?
Thanks, dear, for that lovely question. Firstly, seizure is a neurological disorder that occurs when there is an abnormal electrical discharge in the brain. It can manifest in several ways, but the common ones are jerking of the body, convulsions, stiffness of the body, loss of consciousness, breathing difficulty, involuntary movements of the eye, and lots more.
Oh, that was wonderful, Dr. Melvin. Please, what are the causes of seizure?
Beautiful. The causes of seizure are 1. Fever. This can be from diseases such as malaria, pneumonia, tonsillitis, urinary tract infections. Indeed, any disease which causes a rise in the body's temperature can trigger a seizure. This seizure type is called febrile seizures. 2. Hypoglycemia. This is a situation where the blood sugar is low. Infections of the brain such as meningitis, encephalitis, brain abscess, etc. Ingestion of toxic substances. Head injury due to a fall or accident. Seizures can be life-threatening, however some basic do's and don't, particularly at home or as first responder, can minimize this risk.
Wow, that was awesome, Dr. Melvin.
Thank you.
It's my pleasure, sir. Please, Dr. Melvin, what can one do in order to manage seizure in kids?
Excellent question. As a parent, try to be calm as much as possible so that you can render adequate care to the child and not harm him or her further out of panic. Lay the child on a flat, soft surface. Make him or her lay with the side. This is to prevent aspiration or choking. Remove every harmful object around the child. Remove clothing around the neck to allow the child breathe freely. If the child's body is hot, get a bowl of lukewarm water and a piece of small towel and clean the child's body with it. Leave some quantity of water on the body. The water as it dries reduces the body's temperature. Rush the child to the nearest health facility for further care.
Excellent, sir. Please, what are the things one should avoid in order to manage seizure in kids?
The things not to do because they can cause more harm to the child than good are: do not give the child any liquid or food substance to avoid aspiration or choking. Avoid all herbal drugs. Avoid excessive restraining. Such traditional practices such as squeezing onion juice, giving the child palm oil, or the mother's urine should be avoided. They are dangerous and can worsen the child's condition and even compromise recovery. Note, even if the seizure stops at home and the child becomes awake, Ensure that the child is taken to a hospital for proper medical assessment and management, as seizures have a tendency to reoccur unless what is causing them is addressed. I believe that with these few tips, when next you see a child in such situations, you can be able to lend a helping hand. Remember, you can do all things through Christ that strengthens you.
Wow, that was great, sir. Thank you so much, Dr. Melvin, for coming to this seminar.
Thank you so much, my dear, for having me here. God bless you.
Yes, Papa Ju. A seizure na it be the thing wey dey wrong our pikin o. Na im be say we go do everything wey Dr. Melvin talk, make our pikin dem follow dey better.
Now, true talk you talk, my brother. This knowledge wey we get so, you no go waste. Make I go take care of my boy.